Dr. Kurt Wharton of Phoenix CyberKnife is back with us, sharing revolutionary cancer treatment options they offer. And he's brought along with him a patient. This is Claire Johnson, who was treated for skin cancer there. Great to see both of you. Claire, I want to start with you. Tell us your story.
Okay, last July I was diagnosed with basal cell carcinoma on my face, and it was recommended for me to have a Mohs surgery, which is a surgical excision of that tumor. But a friend of mine had previously told me about what they were doing at Phoenix CyberKnife and how they were treating it with radiation therapy instead. So I went and saw the doctors at Phoenix CyberKnife.
And you said that you just said this is a before photo, before and after photo. You were it just formed above your lip.
Yes.
And you at first were kind of like, it's probably nothing.
Yes, and then one day I was washing my face in the morning and it bled. So that made me more nervous about it, and that's what prompted me to go to the dermatologist.
And the dermatologist told you, in fact, it was cancer. That must have been a very scary diagnosis.
Yes, it can be. Yes.
Yeah, and then you went to Phoenix CyberKnife, and what were the treatment options that they afforded you?
So they told me that they would do a series of radiation applications to my face. It would be about 15 applications, and they would be very short duration, so they lasted 1 to 3 minutes each time I went.
And Dr. Wharton, you've brought that a revolutionary treatment option. You actually brought it with you. It's the item that you used. What is that, and how did it work for Claire?
Yeah, so this is what we call an HDR, high dose rate brachytherapy surface catheter. So we have a device that basically allows us to channel a radioactive pellet to the center of this device, and then we can use that very accurately to put right over the tumor. And with this type of technology, we're able to treat just very superficially, so we can spare the underlying tissues and other organs from radiation.
So this is very precise. I mean, you were really just hitting right above her lip. Did it hurt?
The procedure didn't hurt at all. There was a reaction to the radiation where it was red and it was uncomfortable, but as long as I kept it moist, it was okay.
So 1 to 3 minutes is this treatment. It seems just like seconds. Now this is some more before and afters. This is not Claire, but this is how precise it is, right?
Yeah, exactly. And this is another patient with basal cell near her nose, and again, an excellent cosmetic outcome. So we treat, the primary tumor, just a small margin around that of normal tissue.
Well, how long is a typical patient? We're going to keep looking and scrolling through some of these before and afters, but how long, a couple of months, 15 treatments is what Claire had. Is that the typical treatment?
Yeah, there's several different options. We can treat anywhere from 8 treatments to 30 treatments, just depending on the goals of the patient, how big the tumor is. Generally, bigger tumors, we need to go a little bit slower to get a good cosmetic outcome. With smaller tumors, especially very superficial ones, we can go a little bit faster. So we have some flexibility, and radiation is excellent for areas that are more cosmetically sensitive, particularly on the face and ears.
How are you feeling, Claire?
Fine, yeah.
And you do have to take precautions now, right?
Yes, I mean, I still wear sunscreen every day. Being here in Arizona, definitely.
Will it come back for Claire?
There's a high probability, I'd say 95% chance this will not come back. But patients with the basal cell carcinoma have to be very mindful that they're still at an increased risk to get other skin cancers, particularly non-melanoma, squamous cells, and basal cells.
And you said a friend shared Phoenix CyberKnife with you and talked to you specifically about their treatment options. Did you research other areas as well? Did you go to other doctors, or was this your first choice?
I did actually go to other doctors for a second opinion, but I was more comfortable at Phoenix CyberKnife.
Because you felt why? That they had more options available?
They had more options, and they definitely had, it was a great feeling as soon as you walked into the practice. Everybody was it made it a very pleasant experience.
And Dr. Wharton, we're talking about skin cancer, but you guys treat all sorts of cancer.
Yeah, absolutely. We can really offer a comprehensive array of services for every cancer patient that needs radiation.
And the revolutionary devices, I told you I visited this place, state of the art is the only word that I could describe to describe Phoenix CyberKnife. If you have questions, this team of doctors will answer your questions for you. Phoenix CyberKnife and Radiation Oncology Center, you can email them your questions to info@pcroc.com. They are located at 4611 East Shea Boulevard. That is in Phoenix. You can give them a call, 602-441-3845. You can also visit them online at phoenixcyberknife.com. Thank you both.